Hello, I'm Dr. Pramod Bhor, Director of Orthopedics at Fortis Hospital, Vashi. Today, I would like to speak to you on the topic of arthroscopic ACL reconstruction. So, let us come to when and how we do a arthroscopic ACL reconstruction. So, arthroscopy, it's a keyhole surgery which is done for normally sports injuries. Arthro means joint and scopy means using a arthroscope, that is a scope, which is alleged, it is attached to a camera and we see on the television. So, we do not have to open any joint. It is a minimal invasive surgery. So when an arthroscopic ACL reconstruction is done, so if we consider a knee joint has got an four major ligaments: the medial collateral ligament, the lateral collateral ligament, and two internal ligaments, that is the anterior cruciate ligament and the posterior cruciate ligament. Out of all these, commonest injury that we normally have to treat surgically is an anterior cruciate ligament. So when do we do this? So we do this surgeries basically for younger patients. Older patients, normally these ligament surgeries are conserved above 55-60. Depending upon the activity of the patient, any active patient, ideally speaking, requires an anterior cruciate ligament to stabilize the knee. Any smaller injury or even a trivial injury can cause anterior cruciate ligament injury depending upon the weight of the patient. So it stabilizes the knee when specifically while climbing down the steps. It is very important to understand that when we do an arthroscopic ACL reconstruction, why we should do it. So a patient who is 55 but an active patient who normally runs, jogs, so yes, in those patients also an ACL reconstruction is needed. Comparatively, if I consider a similar age patient, a 55-year-old patient, slightly on the heavier side, but inactive, not moving, not running too much, just basic sedentary lifestyle, then I would say just manage conservatively, strengthen her hamstring or his hamstring muscles and avoid doing an ACL reconstruction. How do we do this ACL reconstruction? This is the second question. So as I said, this ACL reconstruction is done using an arthroscope. It's a keyhole surgery. So what do we specifically do? ACL, when it is torn, it has to be reconstructed. It cannot be repaired. We normally do not repair the ACL because it's an intra-articular ligament. It has got a poor blood supply, and whenever the ligament is gone, we have to reconstruct the ligament. So now how do we reconstruct it? We normally use the patient's self tendons, that is the hamstring tendons. So there are semi-tendinous and semi-gracilis tendons. These we harvest using a harvester. We just take these two ligaments, fold them, make them around 9 or 10 mm in diameter and make a graft which is approximately 6 or 7 centimeters in length. Further on, we make two tunnels through the femur bone, that is the thigh bone, and the tibial bone, that is the leg bone, and pass the newer ligament through those tunnels. Tie the ligament using a tight rope or a endo button and the suture disc on both sides. Before tightening, we normally see to it that we are tensioning the ligament well. Post-surgery, the rehabilitation is also very important. It is not that only surgery is, and it is not the surgeon's only job. The patient also has to take care about post-rehabilitation. We keep the knee in an extended position for a while. Start with heel slides from day 10 to 30 degree. From 0 to 90 degree knee flexion from the second week to approximately third or fourth week. And flexion above 90 degree, 90 to the full flexion after 3 to 4 weeks. So within 6 weeks, complete range of movement has to be achieved. The patient starts putting weight around 2 to 3 weeks on the lower limb. Strengthening occurs after 1.5 months, that is 6 weeks. Once the complete movement is achieved, then the patient has to strengthen and he can go back to his regular jogging, running and everything after 2 to 2.5 months. That is the normal rehabilitation time for an anterior cruciate ligament injury. So advantage of doing an anterior cruciate ligament is that the patient can go back to his regular lifestyle, playing, jogging, running, everything. Secondly, while doing an arthroscopic ligament, if there is any other injuries like a meniscus injuries, it can be treated in the same sit, and the rehabilitation process is also similar. So it is very important to evaluate the anterior cruciate ligament, not neglect it. Evaluation is in terms of clinical examination and imaging, that is an MRI. MRI normally tells us the complete diagnosis, and once it is diagnosed, it has to be treated accordingly. So age group for which we do an ACL reconstruction, I will tell you again, is from younger age, we are around 15-year-old to around 55 to 60-year-old, depending upon the patient's activity. And younger patient, even if the activity is less, we should go ahead and do it. So this is how we do an ACL reconstruction and when and for whom we do it. Thank you.